Hi, my name is Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. As you know, in the office here, we really do try to get at the root cause of what's causing a person's problems. And Brian's story is very interesting, especially for those of you who may need a styloidectomy. So Brian actually got bilateral styloidectomies, and then we'll see how you're doing after that. But you and I first met about 2 years ago, right? So what made you decide to come here, and then what symptoms were you having?
So I had a long year of multiple ER visits and things, from heart palpitation issues, I call it, waking up in the middle of the night thinking I'm having a heart attack, or problems. I continued to go in even after I probably knew that I wasn't having heart attacks, but I was just making sure.
You were nervous.
I was nervous. I'd wake up in panic.
Yeah.
And
real boom, boom, boom,
boom, boom, boom. Yeah, I mean.
And what did they tell you? Like, what did they say?
Well, they told me
just tachycardia. Like.
Yeah, I mean, well, they never really found anything.
Okay.
What they told me is I probably needed an antidepressant, or I needed to calm down or reduce my stress or things like that.
Okay.
But so I had scans, multiple MRIs, CTs. They never did find anything. So at that point, I knew that I was not good, but I couldn't get any answers. So I'm a big YouTube fan, and I started digging through YouTube, and I found you.
Okay.
And that's what brought me down here.
Okay, and then we analyzed you, and then we obviously found you had some instability, but we also found that you had some styloid.
Right. So when I first started coming down, and I would have to look at how many visits. I'm going to say 10-ish, 12, whatever it was. Yeah. I would fly down every month, and I did feel a lot better from it.
Yeah.
And then after I took multiple treatments, I felt good enough. I kind of stopped for a few months, and then I felt like something might be coming back a little bit. I came back down. You treated me again, and at that point we really discussed the styloid problem, and you're like, I really think that you may benefit from styloid surgery.
And then when did you get the styloid surgery?
So I had to wait 6 months to get in to see Dr. Hackman at the University of North Carolina. And then after that, he got me in within 3 weeks of my initial, and my surgery was on December 20th of last year.
And then I'm talking to you just a few weeks, about a month after.
Yeah, we'd be about 5 weeks.
5 weeks, so
5
early
weeks
February.
Out, correct.
Okay, so tell us how it helped.
Well, the first thing, I went in, and after surgery, first thing I noticed is my feet were warm, and my feet haven't been warm for a long time. So, I'm sitting there twiddling my toes, kind of sticking them out of the blanket in recovery, and I'm like, wow, my feet are warm. And that was the first thing I noticed. Wow. After that, I really didn't notice much. I stayed the night because they put drain tubes in, and then they released me the next day, and the following day I flew home. No problem in the airplane, no pressure, no problems of any kind. I haven't taken a pain pill. I haven't had any pain from that surgery. I do have some discomfort in this left eustachian tube, but I think over time the swelling and things will go down. Since then, there's been all kinds of little things that have changed. My blood pressure has dropped some, but the biggest thing is I noticed my glasses were not, it was like my prescription was wrong. So I went into my eye doctor about 3 weeks after surgery, and he started checking my eyes, and my eyes have changed for the better. So my left eye was a minus 0.75, and my right eye was a minus 0.125, and I had stigmatism and a starting of a cataract on my right eye. When he checked me 3 weeks after surgery, I was a minus 0.50, so I'd gained a quarter on this side, but this side went from a minus 1.5 to a 0.75.
Wow.
So I gained a half a point on this eye, on the right eye, and he says he couldn't see my stigmatism or cataract forming anymore. Then he did my eye pressure check, and before I was a 14 and now I'm a 10. So according to him, and I don't exactly understand the pressure chart, but he says I have a normal eye. And he looked at his notes, he looked at his notes, he looked at his notes. And of course I said to him, well, how many people come in here and their eyes are better?
Right.
And he goes, none.
So you're like the first one.
First one, I mean, nobody really knows about eagle syndrome and
Yeah, or how
microcytic-
jugular vein compression can affect
Right.
the eye or whatever.
So that was the first thing. And then the second thing that's happened is I am starting to remember my dreams.
Oh, good.
And I haven't remembered my dreams for, I don't know, as long as years and years.
Yeah, wonderful.
And so, you know, some are good, some are really nice dreams, others are not real nice.
Right.
But yeah, so that's been the biggest thing. I think my energy's up.
Head pressure, headaches, neck pain.
No.
Did you have that prior to the surgery?
You know, I never really had what I would call a headache.
Okay.
What I would get is some bad ringing in the ears, and it's better. My left ear is still kind of ringy, but it's got to be the Eustachian tube.
Okay.
He told me, or I was told after surgery, that that left side, the styloid was kind of wrapped into the Eustachian tube more than it was on the right side.
Okay.
So I don't know. I think as we go by time, it should just get better.
Here, interestingly, let's just talk about the reason why you originally came here, because you had the tachycardia, boom, boom, boom. Was that resolved after the Prolo, or if not, is it resolved now?
Well, I'm just saying from the testing that you've done here, it looks
Yeah.
like Prolo has made a big gain in my stability of my neck. And I think we got to the point where we both agreed that I probably needed...
But the episodes, you know, like you...
Oh, the episodes are gone.
Okay.
Yeah.
Were the episodes gone prior to you going for the styloidectomy?
Yes.
Okay.
Yes, I would
so
say...
at least the Prolotherapy got rid of that.
Prolotherapy got away from the biggest part. I did learn, you know, kind of neck position and some things that you've taught me that help every day.
Yeah, I gotcha.
You know, I mean, I see all...
What about dizziness?
So I run an excavation company, and so I'm setting on equipment. We're moving around, spinning, doing things. I did notice if I had a busy day and I was multiple turns, I could get a little dizziness, and I just would get off and kind of lay on the ground for a couple minutes, get back up, get back in. I was never in a position of danger or driving or things, but I have not been dizzy at all since this surgery. So we'll see. We haven't started into our busy time yet.
Here, I'm going to ask you an interesting question, because, you know, normally folks who would come to see me, they don't want to get surgery. And I'm not saying I want to get surgery either, but why don't you just discuss the whole process of getting a styloidectomy? Like, were you nervous about it? And was it as bad as you thought, not as bad as you thought? Like,
so when I first went and met Dr. Hackman, I guess the hope is, you know, that you always have a fantastic outcome. I wasn't really worried about the outcome as much as I just asked him, you know, is this a complicated surgery?
Okay.
And he says, well, you have a lot of things in there. I got to go around. But for the biggest part, he says, no, you know, I said, is it a problem doing both at the same time? He's like, probably another hour. I can get you, you know, all taken care of. There's no reason why we need to do this one side and then one side. He feels like it's just as easy. You know, and then he just asked me how I feel. And he said, do you feel comfortable with this surgery? I said, I think it's going to be maybe life-changing, game-changing. Okay. I feel like this is something I definitely want to do. So
how long was the operation time? Do you
know? From what I know, about 3 hours. Okay. 3 hours, maybe 3.5 hours.
Okay. And you said you stayed there overnight?
Right. They keep you in the hospital because you have drains. He puts tubes, drains.
But then you went home the next day?
The next day, they take the tubes out before you leave, and I went home, and then I waited one day and then flew back.
Yeah. So you would say that whatever expectations you had for the surgery, the expectations were met, right?
I thought it was probably the easiest surgery. The only thing that bothered me about this surgery is just like, you know, being cut on my face. Okay. And my scars are pretty tiny. I don't think I'm gonna have any problem.
I can't even see them really.
Well, a little facial hair helps, but around the ears and things. Okay. My son, his father-in-law is a plastic surgeon, and he looked at my scars and said they were very well put back together. Awesome. So he thinks that there will be no issue there. So that was my only thing. It was very easy. There was no pain. There was no stretching. I didn't bleed much. The drain, I mean, it was very, very good.
I think a lot of folks don't understand, too, the connection between just sleep and the jugular veins. Because really, the process of sleeping, you sleep primarily So the brain, like for brain health, if you think about it, you sleep for brain health. So when you get deep sleep or you have dreams, it's a sign that you're getting into either deep sleep or REM sleep, which you need for brain health. So that's just a sign that, you know, your brain pressures likely are back to normal and your
The one thing I
brain's
noticed
functioning better.
before surgery, when I slept, I had to have pillows up against me, kind of always lay on my left side. I had to be kind of in a certain position. Now I'm kind of waking up kind of like all over the place because I sleep very sound now. I think that's part of the dreaming.
Awesome.
But yeah, I'm not as conscious that if I move the wrong way, it puts my neck in the wrong spot.
Okay.
So that's
Perfect.
kind of what I see.
Brian, appreciate you,
No, thank you.
telling your story. Thank you so
Thank you.
much.